Physical therapy, PT, also known as physiotherapy, is a healthcare profession, as well as the care provided by physical therapists. It focuses on promoting, maintaining, or restoring health through patient education, physical interventions, disease prevention, and health promotion. The term physical therapist or physiotherapist is used to represent the trained person providing physical therapy. The profession has many specialties including musculoskeletal, orthopedics, cardiopulmonary, neurology, endocrinology, sports medicine, geriatrics, pediatrics, women's health, wound care and electromyography. PTs practice in many settings, both public and private. In addition to clinical practice, other aspects of physical therapy include research, education, consultation, and health administration. Physical therapists provide primary care patient management in conjunction with other medical services. In some jurisdictions, such as the United Kingdom, physical therapists may have the authority to prescribe medication. Physical therapy addresses illnesses or injuries that limit a person's ability to move and perform functional activities in their daily lives. PTs use an individual's history and physical examination to arrive at a diagnosis and establish a management plan and, when necessary, incorporate the results of laboratory and imaging studies like X-rays, CT scans, or MRIs. Physical therapists can use sonography to diagnose and manage common musculoskeletal, nerve, and pulmonary conditions. Electrodiagnostic testing, example electromyograms and nerve conduction velocity testing, may also be used. PT management commonly includes the prescription of, or assistance with, specific exercises, manual therapy, and bodily manipulation. Additional treatments include mechanical devices such as traction, education, electrophysical modalities which include heat, cold, electricity, sound waves, and radiation, assistive devices, prostheses, and orthoses. In addition, PTs work with individuals to prevent the loss of mobility before it occurs by developing fitness and wellness-oriented programs for healthier and more active lifestyles, and providing services to individuals and populations to develop, maintain, and restore maximum movement and functional ability throughout life. This includes providing treatment in circumstances where movement and function are threatened by aging, injury, disease, or environmental factors. Functional movement is central to what it means to be healthy. Physical therapy is a profession which has many specialties including musculoskeletal, orthopedics, cardiopulmonary, neurology, endocrinology, sports medicine, geriatrics, pediatrics, women's health, wound care and electromyography. PTs practice in many settings, such as privately owned physical therapy clinics, outpatient clinics or offices, hospitals, health and wellness clinics, rehabilitation hospitals, skilled nursing facilities, extended care facilities, private homes, education and research centers, schools, hospices, industrial workplaces or other occupational environments, fitness centers, and sports training facilities. Physical therapists also practice in non-patient care roles such as health policy, health insurance, healthcare administration, and as healthcare executives. Physical therapists are involved in the medical legal field serving as experts, performing peer review and independent medical examinations. Education varies greatly by country. The span of education ranges from some countries having little formal education to others having doctoral degrees and postdoctoral residencies and fellowships. Regarding its relationship to other healthcare professions, physiotherapy is typically one of the allied health professions. World Physiotherapy has signed a Memorandum of Understanding with the 4 other members of the World Health Professions Alliance to enhance their joint collaboration on protecting and investing in the health workforce to provide safe, quality and equitable care in all settings. Educational criteria for physical therapy providers vary from state to state, country to country, and among various levels of professional responsibility. All U.S. states have physical therapy practice acts that recognize both physical therapists, PTs, and physical therapist assistants, PTAs, and some jurisdictions also recognize physical therapy technicians, PT techs, or aides. Most countries have licensing bodies that physical therapists must become members of before they can start practicing as independent professionals. Physical therapy related jobs in North America have shown rapid growth in recent years, but employment rates and average wages may vary significantly between different countries, states, provinces, or regions. A study from 2013 states that 56.4% of physical therapists were globally satisfied with their jobs. Salary, interest in work, and fulfillment in a job are important predictors of job satisfaction. In a Polish study, job burnout among physical therapists was manifested by increased emotional exhaustion and a decreased sense of personal achievement. Emotional exhaustion is significantly higher among physical therapists working with adults and employed in hospitals. Other factors that increased burnout include working in a hospital setting and having seniority from 15 to 19 years. Physical therapy education varies greatly from country to country. Worldwide, physical therapy training ranges from basic worksite education in hospitals and outpatient clinics to professional doctoral degree and master's programs. A residency is usually undertaken after the student completes a Doctor of Physical Therapy degree and passes the initial licensure exam. A residency continues physical therapy education with evidence-based training to better equip the resident to be able to help the patients that they will serve. A residency is a specialty designed to advance the resident's knowledge in evaluation, examination, diagnosis, prognosis, intervention, and management of patients within the given subset of patients. Residencies for a Doctor of Physical Therapy are between 9 and 36 months and must be completed within a minimum of 1,500 hours. Residencies may involve community service, research, patient education, teaching opportunities, and the supervision of other healthcare providers. Residencies are currently offered in cardiovascular and pulmonary, clinical electrophysiology, geriatrics, neurology, orthopedics, pediatrics, sports, women's health, and wound care. 33 residencies prepare the doctor to become a board-certified clinical specialist through the American Board of Physical Therapy Specialties, UPS. Residency and fellowship-trained physical therapists report practicing more imaging skills, i.e. utilizing evidence-based guidelines, compared to their counterparts. Fellowship. A fellowship is designed to provide greater evidence-based knowledge in a specialty or subspecialty. To gain acceptance to a fellowship, a physical therapist must have one or more of the following qualifications: 1. Completion of a residency. 2. Board-certified specialist certification. 3. Demonstrate clinical skills within a particular specialty area. Fellowships must be completed between 6 and 36 months and completed with a minimum of 1,000 hours. Fellowships are offered in hand therapy, movement science, neonatal, orthopedic manual physical therapy, and sports division 1 athletics. Those individuals who complete postdoctoral residencies and fellowships are more marketable as specialized practitioners. Specialty areas. The body of knowledge of physical therapy is large, and therefore physical therapists may specialize in a specific clinical area. While there are many different types of physical therapy, the American Board of Physical Therapy Specialties lists 10 current specialist certifications. Most physical therapists practicing in a particular specialty will have undergone further training, such as an accredited residency program, although individuals are currently able to sit for their specialist examination after 2,000 hours of focused practice in their respective specialty population, in addition to requirements set by each respective specialty board. Cardiovascular and pulmonary rehabilitation respiratory practitioners and physical therapists offer therapy for a wide variety of cardiopulmonary disorders or pre- and post-cardiac or pulmonary surgery. An example of cardiac surgery is coronary bypass surgery. The primary goals of this specialty include increasing endurance and functional independence. Manual therapy is used in this field to assist in clearing lung secretions experienced with cystic fibrosis. The treatment of pulmonary disorders, heart attacks, post-coronary bypass surgery, chronic obstructive pulmonary disease, and pulmonary fibrosis can benefit 73 from cardiovascular and pulmonary specialized physical therapists. This specialty area includes electrotherapy/physical agents, electrophysiological evaluation, EMG/NCV, physical agents, and wound management. Geriatric physical therapy covers a wide area of issues concerning people as they go through normal adult aging but is usually focused on the older adult. There are many conditions that affect many people as they grow older and include but are not limited to the following: arthritis, osteoporosis, cancer, Alzheimer's disease, hip and joint replacement, balance disorders, and incontinence. Geriatric physical therapists specialize in providing therapy for such conditions in older adults. Physical rehabilitation can prevent deterioration in the health and activities of daily living among care home residents. The current evidence suggests benefits to physical health from participating in different types of physical rehabilitation to improve daily living, strength, flexibility, balance, mood, memory, exercise tolerance, fear of falling, injuries, and death. It may be both safe and effective in improving physical and possibly mental state, while reducing disability with few adverse events. The current body of evidence suggests that physical rehabilitation may be effective for long-term care residents in reducing disability with few adverse events. However, there is insufficient to conclude whether the beneficial effects are sustainable and cost-effective. The findings are based on moderate quality evidence. Wound management. Wound management physical therapy includes the treatment of conditions involving the skin and all its related organs. Common conditions managed include wounds and burns. Physical therapists may utilize surgical instruments, wound irrigations, dressings, and topical agents to remove the damaged or contaminated tissue and promote tissue healing. Other commonly used interventions include exercise, edema control, splinting, and compression garments. The work done by physical therapists in the integumentary specialty is similar to what would be done by medical doctors or nurses in the emergency room or triage. Neurology. Neurological physical therapy is a field focused on working with individuals who have a neurological disorder or disease. These can include a stroke, chronic back pain, Alzheimer's disease, Charcot-Marie-Tooth disease, CMT, ALS, brain injury, cerebral palsy, multiple sclerosis, Parkinson's disease, facial palsy, and spinal cord injury. Common impairments associated with neurologic conditions include impairments of vision, balance, ambulation, activities of daily living, movement, muscle strength, and loss of functional independence. The techniques involved in neurological physical therapy are wide-ranging and often require specialized training. Neurological physiotherapy is also called neurophysiotherapy or neurological rehabilitation. It is recommended for neurophysiotherapists to collaborate with psychologists when providing physical treatment of movement disorders. This is especially important because combining physical therapy and psychotherapy can improve neurological status of the patients. Orthopedics. Orthopedic physical therapists diagnose, manage, and treat disorders and injuries of the musculoskeletal system, including rehabilitation after orthopedic surgery, acute traumas such as sprains or strains, and injuries of insidious onset such as tendinopathy, bursitis, and deformities like scoliosis. This specialty of physical therapy is most often found in the outpatient clinical setting. Orthopedic therapists are trained in the treatment of post-operative orthopedic procedures, fractures, acute sports injuries, arthritis, sprains, strains, back and neck pain, spinal conditions, and amputations. Joint and spine mobilization/manipulation, dry needling, similar to acupuncture, therapeutic exercise, neuromuscular techniques, muscle re-education, hot/cold packs, and electrical muscle stimulation, example cryotherapy, iontophoresis, electrotherapy, are modalities employed to expedite recovery in the orthopedic setting. Additionally, an emerging adjunct to diagnosis and treatment is the use of sonography for diagnosis and to guide treatments such as muscle retraining. Those with injury or disease affecting the muscles, bones, ligaments, or tendons will benefit from assessment by a physical therapist specialized in orthopedics. Pediatrics. Pediatric physical therapy assists in the early detection of health problems and uses a variety of modalities to provide physical therapy for disorders in the pediatric population. These therapists are specialized in the diagnosis, treatment, and management of infants, children, and adolescents with a variety of congenital, developmental, neuromuscular, skeletal, or acquired disorders/diseases. Treatments focus mainly on improving gross and fine motor skills, balance and coordination, strength and endurance, as well as cognitive and sensory processing/integration. Sports. Physical therapists are closely involved in the care and well-being of athletes, including recreational, semi-professional, paid, and professional, full-time employment, participants. This area of practice encompasses athletic injury management under 5 main categories. Acute care, assessment and diagnosis of an initial injury. Treatment, application of specialist advice and techniques to encourage healing. Rehabilitation, progressive management for full return to sport. Prevention, identification and address of deficiencies known to directly result in, or act as precursors to injury, such as movement assessment. Education, sharing of specialist knowledge with individual athletes, teams, or clubs to assist in prevention or management of injury. Physical therapists who work for professional sports teams often have a specialized sports certification issued through their national registering organization. Most physical therapists who practice in a sporting environment are also active in collaborative sports medicine programs. Women's health. Women's health and pelvic floor physical therapy mostly address women's issues related to the female reproductive system, childbirth, and postpartum. These conditions include lymphedema, osteoporosis, pelvic pain, prenatal and postpartum periods, and urinary incontinence. It also addresses pelvic pain, pelvic organ prolapse, and other disorders associated with pelvic floor dysfunction. Manual physical therapy has been demonstrated in multiple studies to increase rates of conception in women with infertility. Oncology. Physical therapy in the field of oncology and palliative care is a continuously evolving and developing specialty, both in malignant and non-malignant diseases. Physical therapy for both groups of patients is now recognized as an essential part of the clinical pathway, as early diagnoses and new treatments are enabling patients to live longer. It is generally accepted that patients should have access to an appropriate level of rehabilitation, so that they can function at a minimum level of dependency and optimize their quality of life, regardless of their life expectancy. Musculoskeletal and point-of-care sonography. Physical therapists may be credentialed by the APCA in musculoskeletal and point-of-care sonography as sonologists performing and interpreting ultrasound examinations. Physical therapist, patient collaborative relationship. People with brain injuries, musculoskeletal conditions, cardiac conditions, or multiple pathologies benefit from a positive alliance between patient and therapist. Outcomes include the ability to successfully perform activities of daily living, manage pain, complete specific physical function tasks, depression, global assessment of physical health, treatment adherence, and treatment satisfaction. Studies have explored 4 themes that may influence patient-therapist interactions: interpersonal and communication skills, practical skills, individualized patient-centered care, and organizational and environmental factors. Physical therapists need to be able to effectively communicate with their patients on a variety of levels. Patients have varying levels of health literacy, which must be taken into account when discussing the patient's ailments as well as planned treatments. Research has shown that using communication tools tailored to the patient's health literacy leads to improved engagement with their practitioner and their clinical care. In addition, patients reported that shared decision-making will yield a positive relationship. Practical skills, such as the ability to educate patients about their conditions as well as professional expertise, are perceived as valuable factors in inpatient care. Patients value the ability of a clinician to provide clear and simple explanations about their problems. Furthermore, Patients value when physical therapists possess excellent technical skills that improve the patient's condition effectively. Environmental factors such as the location, equipment used, and parking are less important to the patient than the clinical encounter with the therapist itself. Based on the current understanding, the most important factors that contribute to the patient-therapist interactions include that the physical therapist spends an adequate amount of time with the patient, possesses strong listening and communication skills, treats the patient with respect, provides clear explanations of the treatment, and allows the patient to be involved in the treatment decisions. Effectiveness. Physical therapy has been found to be effective for improving outcomes, both in terms of pain and function, in multiple musculoskeletal conditions. Spinal manipulation by physical therapists is a safe option to improve outcomes for lower back pain. 93 Several studies have suggested that physical therapy, particularly manual therapy techniques focused on the neck and the median nerve, combined with stretching exercises, may be equivalent or even preferable to surgery for carpal tunnel syndrome. While spine manipulation and therapeutic massage are effective interventions for neck pain, electroacupuncture, strain counter-strain, relaxation massage, heat therapy, and ultrasound therapy are not as effective, and thus not recommended. Studies also show physical therapy is effective for patients with other conditions. Physiotherapy treatment may improve quality of life, promote cardiopulmonary fitness and inspiratory pressure, as well as reduce symptoms and medication use by people with asthma. Physical therapy is provided to patients in the ICU, as early mobilization can help reduce ICU and hospital length of stay and improve long-term functional ability. Early progressive mobilization for adult, intubated ICU patients on mechanical ventilation is safe and effective. Psychologically informed physical therapy, PIPT, in which a physical therapist treats patients while other members of a multidisciplinary care team help in preoperative planning for patient management of pain and quality of life, helps improve patient outcomes, especially before and after spine, hip, or knee surgery. However, in the United States, there are obstacles affecting the effectiveness of physical therapy, such as racial disparities among patients. Studies have shown that non-white and Hispanic patients may receive lower standards of care compared to white patients. Hispanic patients in particular were found to have difficulties receiving a physician referral for an appointment despite sufficient insurance coverage. Raising awareness of these racial disparities in physical therapy is crucial to improving treatment effectiveness across all demographics. Telehealth, or telerehabilitation, is a developing form of physical therapy in response to the increasing demand for physical therapy treatment. Telehealth is online communication between the clinician and patient, either live or in pre-recorded sessions. It receives mixed reviews when compared to usual, in-person care. The benefits of telehealth include improved accessibility in remote areas, cost efficiency, and improved convenience for people who are bedridden and home-restricted, or physically disabled. Some downsides of telehealth include, limited evidence for greater effectiveness and compliance than in-person therapy, licensing and payment policy issues, and compromised privacy. Studies are controversial as to the effectiveness of telehealth in patients with more serious conditions, such as a stroke, multiple sclerosis, and lower back pain. In the United States, the Interstate Compact, enacted in March 2018, allows patients to participate in telehealth appointments with medical practices located in different states. During the COVID-19 pandemic, the need for telehealth came to the fore as patients were less able to safely attend in person, particularly if they were elderly or had chronic diseases. Telehealth was considered to be a proactive step to prevent physical decline in individuals that could not attend classes. Physical decline in at-risk groups is difficult to address or undo later. The platform licensing or development are found to be the most substantial cost in telehealth. Telehealth does not remove the need for the physical therapist as they still need to oversee the program. Thank you for watching this video.